Timer, and here is your question. Right, so if you have read and understood considering this surgical pathology patient, kindly tell me what are the provisional diagnoses you will consider for this patient?
My provisional diagnosis are carcinoma of breast,
Okay,
benign tumor, gynecomastia,
yes,
sebaceous cyst.
yes. Okay, how would you confirm your diagnosis? What measures would you take?
I will confirm my diagnosis through triple assessment,
Okay, very good.
through
What does it
clinical
include?
history
Yes,
and thorough examination and
yes,
imaging, which include ultrasound imaging or mammography and uh, biopsy, tissue
biopsy as
diagnosis
well.
through
Yes,
FNSC or biopsy.
very good, very good. What are the components of triple assessment?
Thorough clinical examination, imaging
First,
and
first of
tissue
all,
diagnosis.
First of all,
History
history.
and clinical
History,
examination.
yes. History you were missing. Okay. Can
Okay.
you please tell me, after you have done the investigation and you've confirmed that it sounds like mammillary carcinoma, what management plan would you offer to this particular patient?
First of all, I would like to stage the malignancy.
Yes,
And I will do the TNM staging, and if the carcinoma is early stage,
yes.
I will offer him breast conservation surgery, and
Okay.
depending upon his receptor status, I will give him the hormone or Herceptin medication,
Yes.
and if it
Can
is
I
advanced,
interrupt you
yes,
before? Why would you offer breast reconstruction surgery? First of all,
breast conservative surgery. Sorry.
mastectomy or removal, or because reconstruction surgery would be offered afterward, after management.
Yes, ma'am. Sorry,
So
I
yes,
meant breast cancer.
yeah. So all right. Uh, in order to do the imaging, what do you expect to find on mammogram?
I will look for
Can you
loss
help
of.
me? Yes, please read this images, series of images. If you can help me read
Oh,
that, please.
yes, ma'am. On the left upper side, it's
Right upper side, please.
right
What
upper
do you
side
see?
is a,
Yes.
a histology site
Yes,
of hematoxyl neosilin staining,
very good.
showing ductal epithelial
Yes,
hyperplasia
very good. And
with infiltration
yes, and
and
the
and
fat
uh,
vacuoles, etc. as well. Okay, if you
okay.
can move on here, what do you see? What are these series? And what is this arrow pointing at?
It's arrow is pointing as microcalcification in the breast tissue.
Yes. May not be of
And
this image, may not be of the same patient, but what do we see? What are these? My arrow is pointing at more calcification,
that's
maybe.
yes, ma'am.
Yes.
Calcification of
What
breast
is
tissue.
this? Yes.
This is also calcification.
Yes. Yes. What is this? Hollow? What do you see?
This is an ultrasound image showing a cystic lesion.
Very good. Cystic or hello. Okay. Right. Once you have seen this and you've confirmed from the images, what would you say if that is the calcification you've come across for this particular patient? How would you stage it? What are the stages, or how would you stage the carcinoma now?
It can be early stage or advanced stage, ma'am.
Tell me, please, according to TNM.
I will
Tumor
come back
size?
to that question
Yes.
later.
Okay. Right. So you can tell me what type of biopsy one should go for.
I would like to go for a true cut biopsy.
Yes, true cut biopsy and FNAC at the same time. So what
FNS.
would you see in the pathology? What are the
I will look
genes
for
which
the
can be?
type of
Yes,
type of the cancer,
yes,
status of the margins,
yes,
also lymph node invasion,
yes.
and the HER2 receptor status and
Very good.
ERPR status,
Yes.
also PA67 proliferation index.
Considering the history of the patient, what are the most common breast carcinomas that can be present?
Most common is invasive ductal carcinoma.
Carcinoma, yes. Okay. Who would you involve in the multidisciplinary team of this particular patient?
I would like to involve pathologist, oncologist,
Yes,
surgeon,
yes.
radiologist,
Very good.
uh, oncology nurse,
And
social
yes,
worker, and
yes,
maybe psychologist also.
psychologist as well. And maybe endocrinologist as well, because it's a male patient, and
Yes, ma'am.
yeah, could even be that. Okay. So you were also telling me about the HER2 receptors, or what other receptors status would you check? And what is
I
the
will look for the
importance
HER2
of,
receptors
yes,
and ER and PR receptor
yes,
status, estrogen and progesterone receptor status.
yes. And what
Uh,
is, yes, the importance of confirming or knowing the receptor status of the patient's
the
tumor actually?
patients with the HER2 receptor positive
Yes,
are seen in around 15% cases, and they have bad prognosis compared to the ER/PR
very good.
receptor patients. Also, hormone therapy won't work for these patients.
Yes. Can you
And
also tell me, yes, please?
those with ER/PR receptor positive, we have to start them on hormone and treatment like tamoxifen or
Okay.
aromatase
Patient
inhibitors.
is also a smoker. Which
Yes, ma'am.
tumor or which carcinoma is more common in case of smokers, irrespective of the gender, or maybe in females, but smokers?
I will come back to that question
Okay.
later.
What are the biomarkers that that can be found in this particular patient? Okay. What are the risk factors that contribute or lead to the breast carcinoma?
In this patient, or ma'am, general.
Yes, in this particular patient.
In case of male breast cancer, the risk factors include undescended testes,
Yes,
orchidectomy,
yes,
exogenous estrogen exposure,
yes,
smoking,
and yes,
obesity,
yes,
BRCA1 or BRCA2,
yes,
family history.
yes, or even self-medication, like they go to gym and they take hormones and
Okay.
etc. So, okay. So, what lifestyle changes would you advise this patient?
I would advise him to stop smoking,
Yes,
maintain a good diet, and
yes,
lose weight.
yes,
Also, advise him to avoid any alcohol consumption, if any.
yes, if he's taking it, very good. Okay, and yes, can you, in this image, can you tell what kind of images are you looking at, and what are these red circles on in
These are
both of them?
mammograms
Yes,
of breast showing subareolar mass with
yes,
calcifications.
catch, very good. There is one more. What does this arrow is pointing at?
This is a big subareolar lesion
Yeah,
with the calcification and extension to
yes,
the surrounding glandular tissue.
very good, very good. Okay, good, right. what is the normal management that can be offered to the patient with carcinoma, mammillary carcinoma?
Depending upon the stage, we can offer them breast cancellation surgery, wide
Yes.
local excision, mastectomy,
Yes.
followed by radiotherapy and chemotherapy.
Okay, and yes, chemotherapy and radiotherapy, and then hormonal therapy, depending upon
And
the
hormonal therapy.
situation. Okay, very good. Right. Good.